When are thyroid hormone levels tested for patients who are hypothyroid and take thyroid medication? Well, there's a couple of ways you can look at this. And what is interesting is most physicians tell their patients, take your thyroid medication once a day, go get tested, and then come back. And then when they look at the lab, they don't even ask, did you take your medication? Was this in the morning? Was this in the afternoon? They simply look, is it in range? We're not in range, and then adjust based on that. However, it matters. If you take your thyroid first thing in the morning and you go to the lab in a few hours, due to the bioavailability of the thyroid medication, you will get a little surge and a bump in your levels, which is going to last a few hours, and then slowly the body will clear it up. That's why you have to take it every day. If you test at 2 hours after you've taken it or at 8 hours after you've taken it, it's going to show different things. If you test in the morning when you haven't taken your medication, it's going to show you how low you get before you take your medication, right? I make sense. However, what I find is many patients are forgetful, they don't remember, and they don't pay attention. So just so you know, when you take thyroid medication and you are checking your thyroid hormone labs, it matters. You take it in the morning with no medication if the doctor wants you to do so, or you test at 8 hours after you've taken your thyroid medication, so we can understand close to halfway point between one dose and the next dose how that thyroid hormone is impacting you. So ask the doctor when to test. It matters, and it's different if you take T4, which is Synthroid, versus taking T3. T3, for example, liothyronine, or combinations that have liothyronine in them, like the porcine glandular thyroid, the half-life of T3 is very short. It's probably about 4 to 6 hours. So if you take liothyronine in the morning, you really should test at 6 hours later, and you might notice that your T3 levels are very, very low. That means you probably need to take a second T3, and some patients do that, and they split their T3 dose in two. They take one in the morning, one in the afternoon. So long story short, pay attention to your doctor's instructions. I prefer that all my patients, when they take thyroid medication, they take it in the morning and they go to the lab in the afternoon at 8 hours later, probably around 2 or 3 o'clock in the afternoon. And then we can make an interpretation of how the thyroid medication is impacting your body. Ultimately, that's what we want to see. Of course, there should be a clinical interview. How are you doing? How are your symptoms changing? Is anything better? It's not. And then we take all of that into context.